Welcome to Flight Path, the podcast where we explore the journeys behind bold leadership, innovation, and impact. This is where we talk real career journeys, the bold moves and messy pivots, the plot twists that no one puts on LinkedIn, and the moments that changed everything. We're sitting down with leaders, innovators, and rule breakers who figured it out by doing the work, learning the lessons, and sometimes ignoring the map altogether. If you're navigating leadership, healthcare, tech, or just trying to figure out what's next without losing your mind, you're in the right place. So fasten your seatbelts, adjust your altitude, and let's take flight, because we're broadcasting live from Las Vegas at HIMSS 2026.
My name is Maitre. I am the host of Bluebird Leaders, and I am here with...
Ira Hofer from Extrico Health.
Man, I am so happy to be here with you. We have met up in Los Angeles, and we had a great time.
It was a great dinner.
Yeah, the Pink Feather dinner over there. Yeah. Exciting stuff, man. Tell me what brings you here for HIMSS, and what are you looking for out of this experience?
Yeah, so, I'm the founder and president of Extrico Health.
Yeah.
And we have software that pulls the data out of the EHR and makes it more useful for hospitals. And what we're really focused on now is one of our use cases where we can identify misbilling opportunities for hospitals.
Nice.
So hospital billing, right, is based on why the patient's in the hospital, like they had a knee replacement, and then how sick they are, because it makes sense, right?
Yeah.
Someone who has diabetes is harder to take care of than somebody who's like a marathon runner, right?
Yeah.
But what happens is there's so much data in the EHR, hospitals are missing that.
Wow.
And what that means is they're not billing accurately for their patients, and they're leaving money on the table.
Wow.
And when I say money, I'm talking about millions of dollars, even for a small hospital,
Wow.
right? So what we do is we work with the hospitals, we help them identify that opportunity, collect that, and Extrico only takes a piece of what we help the hospitals collect, right?
Yeah.
So we're totally contingency based. So I'm out here at HIMSS today meeting with some of the hospital partners as well as channel partners. So folks like Bluebirds and other organizations that are working with hospitals where we can partner together and help hospitals solve problems. Because today the biggest problem that hospitals have is their finances.
Yeah.
Like hospitals are literally struggling to keep the doors open and pay their staff to take care of patients.
Wow, that is awesome. That's amazing. Now tell me, what in your industry and doing what you're doing for these hospitals, what was one of your biggest wins that you were able to do for a hospital?
I think the biggest win is just when we can help them find the revenue to do that. Yeah. So, we've worked with some large academic centers, right, before, but we went live a few months ago with this small hospital in upstate New York, Nathan Littauer Hospital. I think I'm allowed to say the name. I guess I just did. So, wow. And what's interesting there is they're a small little rural hospital. And when you find a small rural hospital, even tens of thousands of dollars, which is what we did in the first month or so, that's a big difference for them. That's hundreds of hours of nursing care. Yeah. That's keeping their dialysis center open. I mean, I'm a anesthesiologist by training, right? Yeah. And I did my residency. I'd spent most of my life in these big academic centers, and they've got roles to play, but they've also got bankrolls, right? And they've got dollars available, but most healthcare in the United States isn't happening at the big academic centers. It's happening in these small hospitals. Yeah. And when they close and it takes now an hour and a half or 2 hours to drive, that affects the whole community. Absolutely. And so I think, obviously, all of it's rewarding, but to me, that's especially rewarding because it's a big difference for the people that live in those communities. Yeah,
you talk about being rewarded and personal reward. Tell me, what's the importance of personal connection when it comes to conducting business and doing business? Like how important it is to develop a personal connection? I
think we're really focused on that. I've been working in what now we call AI. We used to call healthcare IT or bioinformatics, right, for 20 years. And I'm always amazed that it's not the technology that's the problem. It's always about the people in the implementation, right? And really managing that. From a technical thing, I can go live with a hospital in a few weeks, but now I've got to work with the people on the ground, the CDI analysts, right? To review those. How do you message it? How do you understand what their real pain points are? That's really what it takes, I think, to be successful and to do things. So I think it's really all about the people. And the sad reality of medicine today is people are burned out. Yeah. I'm a physician, like I said, and, so a lot of friends, I don't spend all my time or, taking care of patients now. A lot of my friends that's all they do. And it's harder and harder. Yeah. And it's not just the doctors, it's not just the nurses, it's the people in the back end of the hospitals. The job's getting harder and harder every year or every month. And so I think it's all about the people and trying to devise solutions and do things in ways that we really understand what their pain points are, what their workflows are, and have technology work for them,
Right.
rather than expecting they're just going to change everything
Yeah.
and do it the way the technology works.
Absolutely. Now, I'm in consulting as well.
Yeah.
As part of my day job. Now, you coming into systems and looking at systems and identifying opportunities for improvement, whatever have you, it seems to me, and correct me if I'm wrong, that there's a change realization piece in there.
Oh, yeah.
Right? And so talk to me about how important is change realization at an organization, and what are some of the difficulties you face when it comes to, hey, we pointed this out, but it's going to force you to change the way that you conduct business. Like, how does that work?
It's hard, and I think that's the hardest part. So I'll give you an example. We just went to another hospital last week and presented some initial results, and we found them over $1 million. It's a lot of money,
Yeah.
right? But if you look at it, it kind of breaks down like this. There's some things that it was just like low-hanging fruit. The doctors documented it, everything was good,
Right.
but what happens is there's so much data there, the coder missed it, right? So, okay, that's easy, resubmit the claim and do that. That's still a change management because now they've got to go redo some work that they did before, but okay, like that's not the biggest deal. That's part of their job description, right? Then we've got like another step where it's like, well, they were talking about these other cases where the doctors like just don't document it. You know, you've got a busy surgeon, they've got a lot going on. Yeah, there's some kidney stuff, but like, so how do you convince the surgeon to do that? And you know, I get it because like I said, I'm a doctor, right? So the surgeon's busy taking care of the patient. They've got another case to go. They've got all of this stuff to do. So yeah, they're busy and like they don't want to be bothered by some data clerk telling them. So there's a big piece. And then you get to the even more complicated pieces. Here are all the patients that are at risk for this complication or this comorbidity. Did you make sure a nutritionist screened them? How are you going to like, you know, that's consulting basically, right? How do you get the nutritionist in the right place? How do you do that? Like it's all this change management process. I mean, it's not, there's no silver bullet, right? You've got to be working with the people. And I'm sure you know the saying that we have in quality, every system is perfectly designed to get the results that it does today, right? Like there's a reason why things are the way they are.
Right, yeah, and it takes a lot of collaboration and discipline, and you know, a lot that goes into it. People don't understand when it comes to informatics and technology. A lot of it is the people aspect of it, right?
It's all the people aspect, for sure.
And so it's like not just intelligence, IQ, it's EQ, emotional intelligence, right? Yeah. How has in your professional development, in your personal experience, how has emotional intelligence played a part in what you do?
It's been a huge part, you know, and I think that I thought initially like, oh, you show people the data, you show them the opportunity, and they're just gonna like do the logical thing, right? But it doesn't work like that. No. Like there's so much of like that interpersonal aspect, right? And I think that's honestly like, that's usually the difference between success and failure. It's not that like the data was better or the technology was better. I think that's where it falls apart. And I think honestly, part of the problems that we have with some of the technology in healthcare is a lot of it was designed by people that have never really worked in a hospital, have never taken care of a patient, don't know what the day-to-day reality is. And they're like, well, of course you should do it like this. And it's like, well, no, actually it doesn't make any sense, because if you understand like what it actually means to do these things, right, then what you're saying doesn't reside. So so I think EQ and how you talk to people, how you understand their perspective and where they're coming from, I think that's like, that is the difference between success and failure.
That's awesome. That's awesome. One last question, man. I've been asking everybody this all day. So you're here, amazing experience, HIMSS, there's events, there's the Pink Feather Dinner later on, there's all these things. If there was one word that can encompass what you want to gain out of the experience here this week, what would that one word be and why?
You know, I think to your point, I think it's connection, right? Because I think it is about, HIMSS is overwhelming, right? Like HIMSS is just crazy overwhelming. You walk down there, you can barely walk down the hall. The exhibit floor is overwhelming. But in some ways, that's a lot. But what's nice is so many people are here, right? And it's an opportunity to connect with those people, whether they be existing partnerships and meet face-to-face, or whether that be new partnerships that you know, new friends you're meeting for the first time and building that connection. And I think that's really the value of the conference, right? Is having that opportunity to connect, whether they be people doing similar things to you, different things, getting their experiences, building that connection, because that's the foundation to the success of the journeys we're all trying to take together.
Yeah, that's awesome. That's awesome. Thank you so much, man, for your time.
Thank you, man. This is great. So much fun. Such a huge fan of Bluebirds. It's such a great organization.
Yes.
So glad to be a part of it.